Reproductive health and rights. These are the legal rights that give freedom to individual couple to take decisions with regard to reproduction and reproductive health. The conceptualization of the reproductive health and right can be linked to the early women's struggle to demand their right to legal and safe abortion in the industrialized countries. Later, the concept of women's reproductive health was reformulated in the year 1919 for at the International Conferences on Population and Development, popularly known as the Cairo Conference. Cairo Conference emphasized that women's health is socially constructed, therefore, it is important to understand reproductive health in the context of individual or couple's right to reproductive health. Reproductive health is recognized as human rights issues also. The ICPD defines reproductive rights. These rights rest on the recognition of the basic right of all couples and individuals to decide freely and responsibly the number, spacing, and timing of the children, and to have the information and means to do so, and the right to attain the highest standard of sexual and reproductive health. It also includes the right to make decisions concerning reproduction free for discrimination, coercion, and the violence. Reproductive right is the broader framework under which reproductive health was included and clearly defined. The definition of reproductive health was recognized by the Fourth World Conference on the Women in 1995, known as the Beijing Declaration and the Platform for Action as a human rights issue for women. Reproductive rights may include the following rights for women, which is the right to legal or safe abortion, right to birth control, the right to access quality reproductive health care, and a right to education in order to make reproductive choices. Reproductive health is defined as a care program of action as follows. Reproductive health is a state of complete physical, mental, social well being, and not merely the absence of disease or infirmity in all matters relating to the reproductive system and to its functions and the processes. Reproductive health defined by the CARO program of actions. It is a state of complex physical, mental, and social well being, and not merely the absence of disease or infirmity. In all matters relating to the reproductive system and to its function and processes, the definition of reproductive health has implications for both women and the men. The program of action, the POA in ICPD, place reproductive health and rights as follows. The right of couple and individuals to decide the number, timing, and space of the children and to have information and means to do so. Regulate her fertility through access to information and good health services. Have access to safe, effective, affordable, and acceptable methods of family planning of their choice for regulation of fertility, identification and treatment of reproductive tract infections and sexually transmitted diseases among women, prevention and treatment of RTIs, HIV, remain free of reproductive morbidity, and bear and raise healthy children. During the post-Cairo period, specific recommendations were made by the various international conventions to ensure reproductive rights and health of every woman. Article 10.2 of the International Covenant on Economic, Social, and the Cultural Rights ICESR rights special protection should be accorded to the mothers during a reasonable period before and after childbirth. Article 12.2 of Convention on the Elimination of Discrimination Against Women outlines state parties shall ensure to women appropriate services in connection with pregnancy, confinement, and the postnatal period, granting free services where necessary, as well as adequate nutrition during pregnancy and lactation. General recommendation number 24 and Article 12 of CEDAW direct states to take up the responsibility towards preventing maternal mortality. Article 14.1 of the CAWAD recommends the states to take account of the problems faced by the rural women and take appropriate measures to address these problems. Millennium Development Goal 5 improving maternal health and mortality specifies universal access to reproductive health services by 2015. These are the international forums in which women reproductive rights are specified and demanded action to the state level to improve the condition of reproductive and child health in every community. In India, the still majority of women don't have access to reproductive health services. Further, the POA also recommended a set of development goals for bringing a sustainable and equitable society to implement the reproductive and child health policy. The goals include sustainable economic development, education for girl child, promoting gender equity, equality and women's empowerment, the reduction in the infant, child, and maternal mortality, universal access to reproductive sexual health services. The POA aims towards building a sustainable society in which the reproductive health and rights of every individual can be realized in the policy in India, which were formulated on the basis of the POA of ICPD. In the year 1997, Government of India officially adopted the RCH program and approach and recognized the RCH as the national policy of Government of India. The RCH program introduced a target-free approach to family planning and framed the POA for India accordingly. Immunization of children and access to contraceptive services by the couples, identification, prevention, and treatment of RTIs and STDs, identification, prevention, and treatment of cervical and uterine cancer for women who are in the stage of menopause. Family planning is an integral part of the RCH program. There are some of the indicators which are clearly stated in the RCH program under the Government of India. In the rural areas of India, primary healthcare centers are identified as a core unit to integrate the RCH program into the national health policies of India. Auxiliary nurse midwife became the core agent to provide basic reproductive and child health services in rural areas. Therefore, the role of ANA was further expanded as counselor, educator, service provider, and coordinators of various other health programs. These are some of the basic concepts of reproductive health and rights in India. We have the indicators of reproductive health. First is the quality of care. Reproductive rights aims at ensuring universal access to reproductive health services. The approach of providing care to the clients become an integral part of the POA. For example, the type of care is provided to the clients by the service delivery system, continuous counseling, interpersonal communication, and information sharing between the clients and the service providers became the center of the quality of care. Imparting training for the skill development is also emphasized within the POA of the ICPD. According to SEDIC 2000, the human FPA field study of different countries revealed that there were about 45 countries which imparted training program to service providers to implement the reproductive health and right approach in the countries. Next, we have the gender relation and women empowerment. It is one of the indicators of reproductive health and right. Many countries took initiative to eliminate all forms of discrimination against women, and efforts were made at the country level to create a space for gender equality. According to UNFPA report, out of 114 countries, 98 took positive initiative to ensure gender equality. The positive initiatives include the establishing institution and ministry to look into the rights of women and child, facilitating right to education and health, bringing legal ratification to protect the rights of the woman and girl child, protecting women and girl child from the harmful practices of the community. In India, to name a few constructive initiatives include law against sex selective abortion, Bedi Bachao Beti Padhao 2005 Succession Act, Domestic Violence Act, Sexual Harassment Act 2013, Verma Committee report, Right to Education, and so on. Third is the contraception and abortion. Important area of feminist inquiry within the domain of reproductive health and rights. In the year 2010, the development of pill completed its 50th year. Hence, many experts view that the contraceptive pills have impacted gender relations in a significant way. For instance, the development of pills and the better contraceptive methods has increased women's reproductive choice over unwanted pregnancies, which in turn transforming the maternal health indicators. Unintended pregnancies may result into abortion that is illegal in many countries. In developing countries, abortion related complications amount to maternal deaths when abortions are carried out under illegal and unsafe conditions. Globally, 13% of maternal deaths occur due to unsafe abortion. In case of India, an estimated 1.7% of pregnancy and with induced abortion between 4 million and 6 million abortions are done illegally, and around 9 to 16 of maternal deaths are due to unsafe abortion. Therefore, we can say that the development of pills and other contraceptive methods in some ways has expanded women's reproductive decision making and access to safe contraception. On the contrary, there is not much development has happened towards men access to contraception. The use of the contraceptive methods for men, however, the effort and approach of the family and the government lack towards involving more men to accept major responsibility for contraception. When we talk about reproductive health and right, the focus is more towards targeting women rather involving the men in this process of decision making. A reproductive health approach emphasizes the involvement of men in the reproductive decision making can bring down the gender based discrimination and violence against women in family and society. The Ministry of Health and Family Welfare, Government of India, and its national population policy emphasize the involvement for men for making contraceptive choices and make the efforts for the utilizing the reproductive and child health services in India. Maternal health is a significant dimension of reproductive health. Maternal health risk often increase due to pregnancy, childhood, birth, poverty, and social practices of the early marriage and motherhood. List 2014 lists some of the pregnancy-related complications as severe bleeding during and after childbirth, infection, hypertension, heart disease, diabetic abortion, and so on. These complications combined with the severe poverty increases the risk of maternal mortality in developing countries. In developed countries, the pregnancy related deaths are high among women who have less access to economic resources and modern medical care. In both developed and developing countries, maternal mortality is common among the women belonging to the underprivileged group. Sheja Jaiswal 2012 studies this and her article Commercial Surrogacy in India. An ethical assessment of existing legal scenario from the perspective of women's autonomy and the reproductive rights. The case studies about the Shanti Devi's right to life and reproductive health. She was a BPL cardholder and belonged to the scheduled caste community. In 2008, she carried a dead fetus in her womb for 5 days because she was denied medical treatment from various hospitals and she didn't have the money to pay the hospital fees. Finally, the fetus was removed in a government hospital and she was discharged immediately from the hospital without realizing the condition for her physical health. She got pregnant again in less than 2 years and gave birth to a baby in Jan 2010 without the assistance of any skilled birth attendant and died immediately. The court asked the state of Haryana to pay the compensation of around 2,40,000 to the family of Shanti Devi because it is a form of violation of her human rights. The 11th five-year plan of India specified its own goal as inclusive and faster growth. This is possible by bringing women and marginalized sections of society to mainstream development, in which significant attention is on the reducing the maternal mortality rate in the for which the government is committed to allocate adequate resources for improving maternal health and address obstetric emergency. In year 2004 to 5, Minister of Women and Child Development MWCD outlined the mission statement that is budgeting for gender equity. In India, various institutional mechanisms and policies are formulated to realize the goal of women's empowerment. Some significant policies include National Health Policy, Common Minimum Program, National Rural Health Mission, NRHM. RCH program are focused on women and child health by reducing maternal, infant, and child mortality, providing antenatal and the postpartum care, making accessible, affordable, and appropriate health services to all the specific emphasis on the women and children from the marginalized section of society. In spite of the state's proactive action and the positive discrimination towards women, many poor women in India are still deprived of the basic health rights. There are many stories which tells that many hardly have any access to family planning and other reproductive services in India. This is a case about Jaitun versus maternity home, in which the High Court of Delhi directed at the Municipal Corporation of Delhi and Government of National Capital Territory of Delhi to and 50,000 compensation to Fatima. She is a 24-year-old woman suffering from epilepsy and was forced to give birth under a tree on a crowded street of New Delhi. She was denied delivery of baby by the maternity home in Delhi. The court said it is a case of complete failure of public health system to implement the programs and schemes formulated for reducing maternity and neonatal mortality in India. The court said the complete failure of the implementation of the schemes, with the woman not receiving attention and care in the critical weeks preceding the expected dates of the delivery. They were deprived of accessing minimum health care at either home or at the public health institution. It points to the failure of the referral system, where a poor person who is sent to a private hospital cannot be assured of quality and timely health services. Reproductive rights of adolescents. ICPT clearly states that the importance of reproductive and the sexual health of adolescent girls and boys. In many countries, the discussion on reproductive and sexual health of young individuals is still considered to be a gray area. Therefore, ICPD put much emphasis on enabling the young people to make decisions related to the reproduction when their role as parents. The UNFPA Feed People report suggests that around 55 countries have included adolescent reproductive health in the National Health Plan, and the non-governmental organizations are working in the alliance with the various governments to provide information and services related to reproductive health to the young people. The UN Special Sessions calls out for the following program of action that includes the government of provide confidential services to address effectively their reproductive and sexual health needs, respecting their culture, values, and religious belief, emphasizing the identity and rights of the young people. Furthermore, the governments are urged to include at all levels as appropriate of formal and the non-formal schooling education about population and health issues. One of the major challenges is posed by the international organization and advocates of the women's health movement is towards integrating public health and human rights principle under the comprehensive RCH policy. The main focus of this program was to transform the conventional family planning program into a rights-based approach in which the equity and empowerment of the woman can be ensured within the public health program. However, there is a wider gap between the public health perspective and ensuring rights and equity of women. Many health programs often fail to deal with the socio-cultural and economic condition of society in which the both healthcare providers and the clients are located. Therefore, in many cases, the implementation of reproductive health and rights agenda become a complex issue. As Datta and Mishra rightly argued, after 6 years of India's commitment to reproductive and child health policy, still the policy faces a lot of challenges in terms of understanding the concept of reproductive right. There is a lack of public understanding in viewing reproductive health in terms of women's rights. In India, advocating for reproductive health actually faces challenges for the following reasons. Advocating for reproductive health and rights needs a proactive approach for implementation. The concept of reproductive health continues to evoke discomfort among the women's group policymakers and health practitioners. Concepts like the rights and health have been seen as complex subjects by the policymaker and the program managers while implementing the RCH policy in the field. The concept of bringing child health along the reproductive health to some extent has been unable to address the issues women as independent of the maternal role and responsibility. Our research program to some extent has the principle of the target driven family planning approach as it continues to exclude a single woman from the range of services. Our research program is largely an expansion of the existing MCHFB package with additional services like the termination of pregnancy and towards prevention and treatment of reproductive tract infection and sexually transmitted diseases. ICBD has limited women's health to the issues of the safe abortion and the women's reproductive rights to the extent of making choice over contraception. Central concepts like a comprehensive and integrated reproductive and the child health policy remain will define in the program. At the level of implementation, the healthcare providers feel that they are unclear about how to provide a rights based healthcare facility to all the clients simultaneously. People are recognized as key actors in their own ultimate goals. Strategies are empowering and not disempowering. Analysis includes strategic partnerships are developed and sustained. Accountability system need to be strengthened with a view to ensure independent view.